vaginal bleeding, okay, whether post sex or between periods or after menopause. All right, let me come again with that. After sex, between periods, and even after menopause. There are also people with abnormal discharges. They can be watery, bloody, they can be foul smelling. Hello everyone, today I'm going to shoot from the confines of my car, and I don't know why I carried everything around. I've got my mic here. Yeah, you see, it's not on its stand. My laptop is here. Okay, I've got quite a number of things here. Let me just show you. Yeah, and my bag. But guys, all the same, we are going to try to give you the best of information. I think that is why you are here. So let's get straight into it. I am so keen on this very important topic because it's affecting a lot of people, and so I want you to pay good attention to it, and then if there is anything at all for you to take home, you do that, because there are a lot of people who are experiencing things like bleeding, vaginal bleeding, okay, whether post sex or between periods or after menopause. All right, let me come again with that. After sex, between periods, and even after menopause. There are also people with abnormal discharges. They can be watery, bloody, they can be foul smelling. And also with this particular medical condition, if you are having a discharge, the discharge is so bad. You can even lose your self-confidence as a result of this discharge, because even though the discharge is coming from down there, it may be as if your entire body is that which is discharging. Sometimes there may be some pelvic pain or back pain or pain during sex. Okay, pain during sex. If it becomes more cancerous or it is spreading, then you begin to have edema from your legs. That is swelling of the legs, swelling of other parts of your body. There can also be the lymphatic drainage. You see those lymph nodes, they may also get infected or get obstructed as a result of the cancer cells. So if you know you are experiencing any of these things at all in your life, please hold on, don't go anywhere. I am going to talk about cervical cancer. Cervical cancer. So someone will be of the opinion, what is cervical cancer? Why am I keen about it? Now, if you live in the developed countries like UK, US, Netherlands, Germany, Australia, most of these developed countries, okay, what happens is it's either every year, every 3 years, or every 5 years, the government or the hospital calls you to come in and get yourself screened for human papilloma virus. Or you go, if you've not had it before, especially those in their puberty ages, people who have started having or experiencing their menstrual cycle and etc. Sometimes you'll be called to the GP's office, and then they will do something we call a pap smear. A pap smear, you are going to be in a lithotomy position. That is, your legs are going to be bent at the knee level, okay? You flex it at the knee level, and then you open up, and a speculum is passed under there for them to take some sample from, or some tissue from deep within, and then they are going to test it to see if it has disfigurations in the cells or there is abnormal growth of cells. Now, these things happen as a result of the presence of the human papilloma virus. So when we talk about cervical cancer, basically cervical cancer is the changing of the cells, okay, of the cervix. So if you look at, I will show you an image right here, and then you are going to understand what I'm talking about. If you look at the cervix area down there, you can tell that the cervix has a very smooth lining, Okay, the mucus lining around the cervix is very smooth, so it's just like having that of my inner part of my lips. There's the pinkish area, comparing it to the darker part of my lip. Okay, the cells are different, and so these cells, the darker part is actually growing into the smoother pinkish area, which means that this pinkish area is also going to turn into black instead of pink. Right, now this growth is what we are talking about. The growth in this area is what we are talking about, and I hope by the end of this video you will be able to understand majority of the things. I have some pointers here that I'm going to look on to help you understand this particular thing. Now, the cervical cancer is about 70% of the cases are caused by human papilloma virus, and the human papilloma virus, there are about 5 or even more different variants of this human papilloma virus. Okay, the most important or the most dangerous one leading to this cervical cancer is the HPV 16 and 18. So 16 and 18. Now, these two are the reason why you will be called to the hospital for a pap smear and also a vaccination. Now, the vaccines are doing fantastic jobs to our women or our ladies. Now, be also careful. I'm going to tell you something about some of the risk factors, and you will understand why I'm going to tell you to be very careful as well as an individual. So we have about 16 and 18. They constitute about 70% of all the cases of HPV. Now, the next thing is long-term infection. If you are someone who's been having any of the different types of sexually transmitted diseases, okay, down there, okay, and you've been having this over a very long period of time, you don't pay attention to it, you don't treat it, you sometimes just take or douche, keep the place, instead of the smelling discharge, you just douche and then you put something there to, you know, make the place very okay. Just after that, you leave it, you don't treat it, you don't do what you have to do about it. Now, that keeps us thinking. Now, these discharges, these things that are happening to you, have you treated it ever? No. You keep on doing things just to make it be relieved from the current symptom you are experiencing. In this case, you are constantly causing scarring of the cervix tissue. Okay, the area of the cervix, you are constantly making that area very, very scar. Okay, it's like you constant hit one place, that place is going to get reddened. After it becomes reddened, that place is going to sore, and when it sores, other protective part of the blood will come and heal that area, thereby causing the scar effect at the area. So that is what happens to the cervix, and the more it constantly grows, the cervical cancer becomes one of the most dangerous things you are going to experience. Now, looking at other factors, we have weakened immunity, like people with HIV/AIDS, right? Their immune system is very, very weakened. Another one is people with diabetes. You have to be very careful. You have to make sure you are treating your diabetes very, very well as part of the management. There is also multiple sexual partners, especially those with trying to be promiscuous. Now, you have an adventure with this person, you do with that person, you are just moving the STD from one point to the other. Now, you yourself, let's say you get yourself treated as a woman, you get yourself treated, but don't forget, you gave it to me. You gave it to me, and that is the most dangerous part. All men come here. Now, you are reservoirs for HPV virus. You are reservoirs. So in this instance, the man you gave to is going to keep it for you. So the next time you go in and then you try to have an affair, you tend to pick it up again and that is a very serious thing. Another thing is smokers. If you're a smoker, what you are doing to your body or your cervix is that you are preventing the oxygen from reaching the cervix, which means that it's only the carbon monoxide, dioxide, or the toxic part of the smoke that is which deposits around the cervix. So there is a very, very big issue. Now this one will shock you. Those who are on long-term oral contraceptives, please pay attention. Long-term oral contraceptives, please be very careful. After a couple of years, make sure you switch. Let's say you can go for the dermal one, the intrathecal one, whichever type of, just make sure you get a different type. The IUDs are there, stuff like that, okay? Instead of just staying on the long-term oral contraceptive, that becomes a very, very huge issue. All right, so you need to work around it when it comes to contraception. Okay, so at this point, let me explain how the cervical cancer may occur, or how the HPV even happens, how it gets into the body. You see, during sex, there are things we call microabrasion. Microabrasions are like, you know, you've gotten a scratch. You know that thing, like you are walking behind a main building, and then let's say you just throw your hands and then it scratches the wall. You get these tiny abrasions, and that actually occurs during sex. Whilst you are penetrating, it causes abrasions. Now these abrasions tend to have the HPV virus penetrating through the abrasions, and then they get to enter into the bloodstream. Now in the bloodstream, they are going to suppress, because the DNA of the HPV has to replicate, so they are going to suppress your tumor suppressor genes. Now once they have suppressed the tumor suppressor genes, they get the chance to then begin to replicate. And then especially what I mentioned about those with low immunity, once that happens, the immune system is already down, so it allows the HPV virus to replicate and then grow more, and then begin to cause a lot of issues. Now that is the issue I don't want you to get to. And that is the same way people who are having different sexually transmitted diseases, that's the same way you are going to transmit it from one point to the other. So if you are experiencing things like vaginal discharge, it could be bloody, it could be watery with foul smelling, please be very, very careful. Now when you are bleeding, you have sex, and then there is so much pain, please, it's not just normal. It's not normal. So pain on sex, that is on contact, right? And then the bleeding keeps on coming, either with sex, in between your menses, or even after you are in menopause, you are bleeding. That should trigger as a very high warning to you. Get to the hospital and go get yourself tested or checked by doing the pap smear. When you begin to have pain in the pelvic region, in your waist, there are a lot of women who associate their waist pain and other things to just work and stuff like that. Please, you must check to know whether this is associated with the work you are doing, or okay, so your doctors might request for an MRI, an X-ray, etc., to actually tell what is happening down there. Also, you may be having it may tip you even into an early menopause, okay, early menopause, and you have to look at it very, very carefully. There are people at 40 years and they've started their menopause. Why is that so? That is really, really dangerous. So you need to look into it very, very well. Let's talk about prevention and screening. So when we talk about HPV vaccination, nearly 100% effective against the key HPV variant. Okay, now before sexual debut, that is with people who are yet to have their first encounter of sex, okay, that is if you've had the vaccination done before your first sexual debut, then it prevents most of the cases. Safe sex, when I say safe sex, when you are using condoms, you are not smoking, okay, you are not doing drugs in order to have sex and stuff like that, you tend to protect yourself, you tend to help yourself from getting this HPV vaccine, right? And also you can see that if you screen with a pap smear every 3 years, so the year, sometimes I don't even want to mention them because it has to do with various countries. There are certain countries they want to screen you on yearly basis. Certain countries will screen you every 3 years, and other countries will screen you every 5 years of the HPV until you are 65 years. Now immediately you get there, they don't really care whether you have to be screened or not. I mean, from 65 years and above. Now, this is what I want us to know now. If you are from Africa, especially if you are from Asia, places like India, okay, where you don't really get a call from your GP to tell you that you need to come in for an HPV screening or a pap smear, please, this is the point I need you to take it to yourself. You need to get up, go there yourself, go to the hospital, get yourself screened. Okay, tell the doctors that this is going to be my first time coming for an HPV or a pap smear. The name is pap smear, PAP. Pap smear. It has a full name. I don't think you need it. Papa Nicola. You don't need it. So just take the short form, pap smear. Now, when you get there, you tell them that this is the first time you are coming to have a pap smear done. If you are sexual, you can tell them that, oh, you've had some, experiences. Otherwise, if you've not, you can tell them that you've never had it, but you want to get yourself vaccinated before your first debut. And that is what is going to help. I want to plead with each and every one of us on this platform now that I want you to have yourself screened. And that will help us reduce the number of occurrences or the prevalence of these cases in our various countries or our various ages. So since this is an educational platform, and what I do is I bring heavy or very strong medical cases, and then we break them into minute forms for your easy understanding. This is what I'm going to do. I know you are waiting for me to tell you whether there's treatment or not. Yes, there is treatment when spotted early. That is point number one. The screening and prevention is the most important thing when it comes to cervical cancer. So what I need you to do is what I have pleaded you to do. Go get yourself screened. That's the first thing. Now, when you are experiencing any of the symptoms I've talked about, including the bleeding, the discharges, the pain on touch and on contact, all these things, when you begin to experience some of these things, I will plead with you to go to the hospital, because there are some very important therapeutic and diagnostic ways of managing cervical cancer. They may scoop some out. Okay, I won't tell you the terms because it's not your profession. The doctors know what to do. Your ONG consultant and specialist, they know what to do. They may scoop some. They may use even a hot flame to actually scrape some off. I won't go too much into it. There are also immunotherapies that, like, these are recent or new forms of treatment, okay? But you have to go to the hospital, report yourself, and get yourself checked. Once you've checked in, your doctors are going to work out what will help you in order to prevent the progression of this cervical cancer. If spotted early, something can be done. But when left and it becomes late, it's very difficult to salvage the plan. I hope you have enjoyed everything from the confines of my car. Now, I want you to kindly help me by subscribing to this channel, like this page, and make sure you share it to someone, because this will benefit you, especially those from Africa, Asia, and places where you won't be called. You won't be called to come into the GPs to get yourself checked. Please share the video for someone to also benefit. If you have any question at all, drop it in the comment section and I will answer you. I love to answer my people. So guys, we'll be shooting next. I don't know if it's in the car or in the studio. Cheers.